السلام عليكم ورحمة الله وبركاته. Dear brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a new episode of Health from Huda TV. Sleep, this beautiful and pleasurable event that happens to all mankind and almost all other creatures. Allah has mentioned sleep in Quran in several places, in several verses. In Surah Ar-Rum, Allah says, وَمِنْ آيَاتِهِ مَنَامُكُمْ بِاللَّيْلِ وَالنَّهَارِ, which is, could be translated as, and amongst His miracles is your sleep during night and during daytime. And in another verse in Surah An-Naba, Allah says, وَجَعَلْنَا نَوْمَكُمْ ثُبَاتًا, which could be translated as, and we have made your sleep as a method of rest. And it has been mentioned in many other areas and verses in Quran, saying that sleep is a great miracle and a great blessing for us. Today we're talking about sleep and the problems that happen to us during sleep. With us is Dr. Mustafa Shaw'i, consultant of pulmonary diseases, Ain Shams University. Welcome, Dr. Mustafa.
Welcome, Dr. Ahmed.
This episode about sleep, I'm sure
Yes.
that would be very interesting to many of our viewers, because nowadays many people do have problems with sleeping.
Yes.
And to start with, why is sleep important to us?
First, I will begin from your word. It's a miracle. Sleep is a miracle from from Allah.
Yes.
To relax our body, because we during all the day we have muscle activity, brain is working, heart is working, but as a machine, our body as a machine, it has to relax.
Yes.
And the sleep is the only mechanism we can relax by this mechanism. During sleep, relaxation of the muscles, and there is a lot of physiological change which occur during sleep to restore our energy to second day.
Yes. Oh, physiological changes. What are the physiological changes that happen during sleep?
During sleep, first, there is we study the sleep and we study the physiological events which occur during sleep time. First, we find there is increase in the blood flow to the brain.
Mm-hmm.
Increase the level of the hormone, growth hormone, what's called growth hormone, which is responsible for growth of our body.
Mm-hmm.
Which can, by measuring the levels of the growth hormone, it's increased during night, especially in the children.
Yes.
During sleep, there is gradual decrease in the heart rate, because we have a nerve in the body which is called the vagus nerve, responsible for decreasing the heart rate.
Yes.
Also, the blood pressure. The blood pressure is lower during sleep than during daytime.
Mm-hmm.
Fortunately, also, if patient with any type of arrhythmia, we found this arrhythmia is minimally during sleep, and this is good for this patient.
Yes.
Respiratory, as regarding respiratory system or items, there is decrease in the respiratory rate, relaxation of the lung, decrease in what's called minute ventilation, all of this just to restore our energy to the second day.
That's very good. So, the blessing of sleep, many of people don't really enjoy it
Yes.
because they have sleep disorder. As we said, what could cause sleep disorders?
Look, Dr. Ahmed, we have statistics. For example, in USA, we found at about 180 million people suffering from disorder in the sleep.
That's a huge number. Of
Yes,
people.
it's
Yes.
sleep disorder. You have different type of sleep disorders. We have what's called dysomnias. We can divide it. It's what's called obstructive sleep apnea.
Yes.
Sleep apnea, which apnea what means a cessation of breathing during the sleep, more than 10 seconds. It is caused secondary to the obstruction of the upper airway. Another type of sleep apnea is what's called central sleep apnea. Secondary due to sedation or diminished activity of respiratory system in the brain. Also, there is another type of sleep disorder breathing, what's called hypoventilation syndrome.
Yes.
Some people who are obese complaining of some sort of hypoxia, which means decrease in oxygen level during sleep, and this is a dangerous process.
Definitely.
Yes. Another type of sleep disorder, especially in the children, what's called nocturnal enuresis.
Yes.
It's
They micturate while being asleep.
Sleep, yes, it's more common in the children.
Yes.
Or something what's called walking during sleep. We
Yeah.
have patient walking during sleep and it's unconsciousness.
This is true, not just in the movies.
No, it's true.
It's
true.
true.
It's a psychiatric problem.
Yes.
It's a dangerous problem. Should be managed ideally.
So we're talking about sleep apnea in this episode in
Yes.
particular. So get us more closer to what happens during sleep apnea.
I have a video here, a small video here. We can see
Yes.
in this video to show us what happened during sleep in patient with sleep apnea syndrome. This is something difficult. Okay. As we see here, a patient with sleep apnea is breathing now, and
Yes.
there is apnea. Now it's apnea, no flow. Suddenly awakened from the sleep because of choking,
Yes.
and he is awakening now from the sleep, and then he will sleep again.
Yes. Yes.
Okay, another type. We continue. There will be another attack of sleep apnea. Yes.
Oh, yes. There it is.
That's it. And awaken from the sleep. These figures show this means the flow of the air, stoppage of the air.
Yes.
From the stoppage of the air. And this will lead to abnormal accumulation of carbon dioxide level, which awaken from the patient from the sleep. This type of apnea is called what's called obstructive sleep apnea.
So there's obstruction of the
Yes.
air,
Upper
going,
airway.
upper
Yes.
airway from going into the lungs.
This is the lung, yes.
Yes.
There are many factors which cause this obstruction. Simply, what's called tonsil hypertrophy.
Yes.
We have the tonsils. If hypertrophy, they will close the upper airway, or what's called adenoid hypertrophy also. Enlargement of the adenoid gland, especially in the children, or abnormality in the nose. If there is deviation of the nasal septum or nasal obstruction by any causes,
Yes.
all of this leading to the obstruction of the airway during sleep.
Yes.
Okay. Another type hypertrophy of the upper soft, what's called soft palate.
Yes.
Yes, all of this causing obstruction of the air during sleep.
So when some person has sleep problem or sleep apnea, what do they experience? We saw in the video the person was sleeping. He has
Yeah.
some difficulty in
breathing.
but still he's sleeping.
No, but he get uncomfortable sleeping because he's awakened several times during night. And this is one of the cause of the when he awaken in the morning, he feel fatigue. He did not take that enough time for the sleeping. He sleep yes, he sleep, but it's uncomfortable sleep.
Yes, some people would have snoring while sleeping. Is that related to sleep apnea?
Sure. Snoring is one of the key symptoms of the obstructive sleep apnea, and I have I have a video here.
Yes.
Showing how snoring occur. During passage of the air, there will be vibration of the upper airway. As we see here, there will be vibration of the soft palate during passage of the air.
Yes.
This occur in obese patients who have hypertrophy. As you see here, there will be vibration now. Yes, that's it.
That's
this vibration, which causes a sound which we heard during sleep. Okay, snoring sure is one of the key symptoms of the obstructive sleep apnea. We ask the bed partner to the patient. We don't ask the patient because he doesn't auscultate himself. We ask the bed partner if he's snoring during night. She or he will say yes.
So this is being inflicted not only on the patient but also
bed partner.
Yes. So the sleep apnea is
his
a
wife
disease of the family, the whole
yes,
family.
It's a family problem.
Yeah.
It's one of the it's snoring by itself is one of the cause of the divorces in Egypt or in Arab world.
Yes. So when somebody comes to you, because I'm sure that many people do not have the idea that this could be treated. They just live all their lives feeling tired, not getting enough sleep, and they just go on like this. They don't have the idea that this could be treated and this could be dealt with, and there's a cure for their problem. But for those who would come and know that there is a problem, how would you investigate or how would you manage the case?
First, we take the history from this patient or his wife or her husband to know the symptoms. If we ask the bed partner if he has snoring during sleep, or if he has apnea during sleep. What's apnea means stoppage of the breathing for 10 seconds, about 10 seconds, then regain of the breathing by a case of hyperventilation, rapid breathing, and this occurs frequently during night. According to the degree of the obstruction which occur with apnea and the attack of apnea, we can diagnose it a case of mild or moderate or severe bronchial asthma. We ask the symptoms. As we said, snoring is a key symptoms. Second type is daytime sleepiness.
Yes,
it's one of the main symptoms. Yes, his sleep while watching TV or while sitting in the car in bus stop.
Yes,
or during walking, during reading a book, he will fall asleep.
That's a big problem, and it could cause lots of
daytime
difficulties. Yes, difficulties in life. We'll be talking about this more. We have a short break, brothers and sisters. We'll be back, inshallah, to talk about this problem about sleeping. So please stay tuned. Until then, assalamu alaikum wa rahmatullah. Dear brothers and sisters, assalamu alaikum wa rahmatullah. And we're back and we're still talking about sleep disorders, especially sleep apnea. Dr. Mustafa, we were talking about a person who would even fall asleep while working or driving or walking. This could cause a major catastrophe. I mean, this is really serious. It's not just feeling tired from not sleeping well by night. This could lead to a real problem.
Yes, it's a major problem and a catastrophic problem.
Yes,
because this patient who complain of obstructive sleep apnea, it's one of the causes of the motor car accident, because he fall asleep while driving.
Yes,
and he doesn't know that he fall asleep. The car accident occur while he's sleeping.
Yes,
and it's one of the most common causes in more car accident in Egypt and all over the world.
So, what other complications that could happen from this sleep apnea problem?
As we said before, some sort of hypoxia or decreasing blood oxygenation which occur during sleep causes the changes in the blood vessels, especially coronary blood vessels, which are responsible for supplying blood to the heart.
Yes.
And it's a major cause of cardiac attack.
Yeah.
You know, it's cardiac attack is more in patient this with obstructive sleep apnea, because there is pathological change and causes atherosclerosis. Atherosclerosis, stiffness of the wall of the arteries.
Yes.
In the coronary, and these attacks of coronary may cause deaths.
That's true.
If it's not treated properly.
Exactly, yes.
And the same pathological change which occur in the coronary occur also in the carotid arteries, which are responsible for blood supply to the brain and cause what's called transient ischemic attack or stroke.
Yes, that's true.
And it's a major problem, and one of the most common cause also of stroke is obstructive sleep apnea.
This definitely is.
Second, on pulmonary blood, pulmonary blood vessels may causes increase in the pressure in the pulmonary artery, and what's called pulmonary hypertension, which cause dyspnea.
Yes.
Dyspnea or shortness of breath.
Shortness of breath, yes. The person cannot breathe at ease.
Yes. Another issue is change in the blood composition of increasing platelet count, which is responsible for coagulation of the blood, or increasing blood fibrinogen level, which is responsible also in decreasing the viscosity of the blood. We have a multiple researches about this issue, and we found there is increased platelet, increased fibrinogen level, which causes stroke or causing cardiac attack. Another issue is nocturnal enuresis, which has a psychological problem to the patient, because it's psychologically unacceptable.
Of course.
Patient doesn't get comfortable sleep. He will awaken in the morning, feel depressed, psychologically upset, confusion, depression.
Of course, yes.
And this is a major problem to them. All of this is a complication of obstructive sleep apnea. So should be measured probably, and it's a simple measure. It's simple. It can be measured simply, inshallah.
Inshallah. So when somebody comes with treating sleep apnea, is not, or she's not just treating sleep apnea, they're also avoiding even more or major complications and problems that they would face or might face if they don't treat the sleep apnea. So when you diagnose the sleep apnea, what investigations that you would do to make sure this is the real diagnosis, and to be able to differentiate the causes of the sleep apnea?
Okay. First, as we said, from the symptoms and the signs, we can diagnose bronchial diagnosis of sleep apnea. But the key items in the investigation of sleep apnea is doing what's called polysomnography.
Polysomnography. That's, in other words, in simplified.
It's a simple device which patient we can measure everything which can happen during sleep. We can measure the stages of the sleep by drawing what's called electrocardiograph, EEG.
Yes.
We measure the changes in the heart by ECG, electrocardiogram.
Yes.
We monitor blood pressure during sleep, pulse changes for heart rate, and for sleep we measure what's called apnea. Well, as we said, it's a cessation of breathing by measuring the flow in the during sleep. Also, we measure the movement of the muscles, and you can measure also a lot of things.
Yes.
The most important oxygen desaturation. We measure the oxygen level.
Yes.
And we can calculate what's happening during oxygen in the blood, if it is severe or it's a mild case of hypoxia or severe hypoxia. All of this, the patient come to us in what's called sleep lab.
Yes.
We connect them or connect him to the device and sleep in the lab for one night.
Yes.
And in the morning, we measure all of the record in the computer, analysis of all this data, from which we can diagnose obstructive sleep apnea.
So you diagnose the changes, and you also diagnose the cause of the sleep apnea as well.
Yes, we can, from this polysomnography, we can differentiate it. It is obstructive sleep apnea secondary to causes of obstruction for upper airway, or it is a central sleep apnea from the brain, and there is no obstruction.
Yes.
We can differentiate from polysomnography.
I'm sure our viewers are very anxious to know how would you treat the sleep apnea.
Yes. First instruction, general measurement. Most of these patients with obstructive sleep apnea are obese.
That's true.
Obese. We measure body mass index. By obesity, by definition, it's a body mass index more than 27. First, to tell him, instruct him to decrease her weight by diet therapy or exercise.
Yes.
Decreasing weight is the main line of treatment. Second is surgical correction if there is a cause for obstruction, if there is division of the nasal septum, or if there is hypertrophy of the tonsil or adenoid, we refer him to ENT consultant for surgical correction. And we are using laser for treatment of the hypertrophy of the soft palate.
And it could be a small surgery that can spare a big problem, or a series of big problems.
Protect us from a big problem and more complication, protect from more complication.
Yes, what else?
After general treatment, the main line of treatment of obstructive sleep apnea device, also we give him a device what's called CPAP. And I have a small video here, we can see how CPAP can act. As you see in the video, the flow of the air either from the nose or from the mouth through obstructed airway. And now we will connect him to the device, as you see, what's called CPAP.
Yes.
This device, CPAP, is a pressure. It is a pressure system. It will open the obstructed airway, as we can see now.
Yes.
By the pressure, it will open the soft palate and allow the air to pass simply from the pharynx. This.
Yes.
CPAP is, we have two types of CPAP. Either it's connected to the nose, it's called nasal CPAP, or mouth, or through mouth DPAP. We determine the pressure which needed to open the upper airway during a split night. Where patient come during the night.
Yes.
We diagnose diagnosis of obstructive sleep apnea and adjust the pressure which opens the upper airway.
Yes.
As we see,
there goes the
there will be this obstructed airway now, and we'll connect him to the device again. We determine the pressure which opens the airway during night by connecting him while during sleep. Simply the air now is passing. Okay. This device, another type of pressure which allow breathing, it's called BiPAP. Give him breathing during inspiratory and during expiratory. With decreasing the weight, the problem will be solved, inshallah.
So this machine would stay with the patient for how long?
As long as he complains of sleep apnea, he will relax for the machine, and he will accommodate for that, because he will get his comfortable sleep. He will love it.
But sleeping with a machine is sort of a...
In the beginning, it's a difficult process to have a machine on your nose while during sleep. But if you have the patient complaining of fatigue or complaining of symptoms of sleep apnea, but after using this machine, he will ask to continue with this machine because he get comfortable sleep.
Yes, he'll be waking up more fresh and much happier than he used to be. And of course, his partner or the family would have less snoring by night, and does this help with the snoring problem?
Mostly it
Mostly,
will
so
improve
it's not just the patient, but also everybody around him
yes,
is
yes.
getting a better chance of good sleep.
Comfortable sleep is the main issue.
Yes. Dr. Mustafa Shawqi, consultant of pulmonary disease, Ain Shams University, thank you very much for being here with us today.
Thank you.
Brothers and sisters, I hope you enjoyed this episode. Hope it was useful to you. Inshallah, until next episode, please write to us. Our email is health@huda.tv, and of course, our website is huda.tv. Until next time, wish you a healthy life, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.